Okay, I'm going to start right now.
The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody, and welcome to today's webinar and panel discussion in honor of International Nurses Day, entitled Nurses, a Force for Change, a Vital Resource for Health. I'm Jessica Havlack, and I'll be organizing the webinar today, although Emma Croghan will be moderating. Just a few housekeeping items before we get started. I want to let you all know that you will be muted for the duration of the webinar, but if you do have questions for the panel, you can enter them into the questions panel on the right-hand side of your screen. During the webinar, Emma will be sifting through the questions and can pose as many of them as possible at the end of the session. And since we have a relatively small number of people on the line today, we may try unmuting individuals to ask questions themselves, so stay tuned for that. Also, the webinar will be recorded and archived on our website at www.globalbridges.org in the resources section, and that should be up later this week. And if you would like a certificate of participation for today's webinar, please fill out the survey at the end of the session and indicate that you do need a certificate. So our moderator today is Emma Croghan. Emma is the co-regional director for Global Bridges in Europe and is a registered general, sick children's, and specialist public health nurse who has worked in tobacco dependence since the year 2000. She set up and ran an early smoking cessation service in England within the National Health Service, has worked in practice, training, research, and policy within tobacco-dependent services and tobacco control at many levels, and was the tobacco control delivery lead at the English Department of Health until 2012. So without further ado, I'm going to turn this over to Emma.
Thanks, Jess. Good morning, good afternoon, good evening, wherever you are in the world, and welcome to the Global Bridges webinar. Happy International Nurses Day 2014. As Jess said, I'm a nurse and I'm the co-director, regional director for Global Bridges Europe with another nurse, Andy McEwen. So I think regionally we're quite unusual that we've got two nurses as the director. I think it's a privilege on Florence Nightingale's birthday to be chairing today's webinar and to discuss the role of nurses in tobacco dependence treatment around the world within the context of that International Nurses Day. The theme of Nurses Day, and I know for some people it's past, it was yesterday for Grace, for example, it talks about nurses being a force, and we are a force. We're the largest single group of healthcare professionals. We're the single biggest group. We have the single most opportunity to identify and intervene with our smokers. We're trusted, we're well educated, we are ideally positioned. And we are a force for change, so at the individual, family and community level. Nurses are change makers, that's our job, isn't it? We're natural change makers, we work in behaviour change techniques, we're trained in goal setting, being outcomes focused, action planning and feedback. So I think that it's brilliant that we're having this session today, and it's lovely that there are so many of you listening and participating, hopefully. And it's an absolute privilege to welcome our three panellists. We've got Linda Sarna, who's a Professor of Nursing at UCLA and who's heavily involved in the Tobacco-Free Nurses Initiative. We've got Antoinette Barton-Gooden, who's a nurse educator in Jamaica. And we've got Grace Wong, who's the director of the Smokefree Nurses, one of the Smokefree Nurses groups in New Zealand. What I'd like to do is hand over to each of those to introduce themselves to you for a moment. So, Grace, can I hand over to you just to introduce yourself properly?
Hi, everyone. It's lovely to be here with you all, the ones from New Zealand and the ones from other parts of the world. I'm Director of Smokefree Nurses Aotearoa, New Zealand, and Coordinator of Tobacco Control Nurses International, and based in the School of Nursing at Auckland University of Technology. My work in tobacco dependence treatment is both national and international, and as Director of Smokefree Nurses, I work in close partnership with Indigenous Māori, Pacific Island mental health and primary healthcare nurses. I'm Coordinator of Tobacco Control Nurses International, and as such, we supply the blogs and member spotlights to Global Bridges. We also work with our national nursing organisation to advocate for support for smoking cessation interventions by nurses at the International Council of Nurses. So today I'll be presenting, when I speak, the perspective of mobilising nurses in the context of the New Zealand Government commitment to reduce smoking prevalence to below 5% by 2025, which includes requirements to meet national smoking cessation targets, meaning that nurses in primary and secondary healthcare have to deliver brief smoking cessation interventions. And the targets are that 95% of hospitalised smokers receive a brief intervention, and this target's been met for over a year now, and that 90% of people who smoke are enrolled to receive primary health care and general practice settings get a brief intervention annually. 65% in the last quarter and trending upwards. Yeah, so I'm looking forward to hearing from Antoinette and Dr. Sarna, and to hearing your questions, and I hope I can contribute and support our joint efforts to normalise smoking cessation interventions in practice, the practice of nurses. Thank you.
Thank you, Grace. Antoinette, over to you. Would you like to introduce yourself to our colleagues?
Yes, thank you so much. Good afternoon, everyone. I'd like to say Happy International Nurses Day to my colleagues worldwide, and hello to my most esteemed co-panelists, Dr. Sarna and Dr. Wong. I am a nurse educator for the last 7 years, and I have been conducting respiratory research at the sickle cell unit for the last 4 years. Now, it was my interest in smoking cessation that led me to participating in Global Bridges, where I've seen so many persons in the hospital have smoking-related conditions, and I felt that we needed to intervene. So I got some training in 2012 via the Heart Foundation, and since then I've been introducing elements of smoking prevention and information in my lectures in the undergraduate program. I have not been so involved as Dr. Wong and Sarna, so I'm looking forward to participating in this group discussion because I'd like to strengthen my skills in tobacco dependency treatment.
Thank you, Antoinette. Linda, can I ask you to introduce yourself to everybody?
Hello, everyone. It's my honor and privilege to be with you today greetings from sunny California, where we might get almost up to 90 degrees today. I wanted to provide a little background about my history because it provides a different sort of context for my approach to tobacco control. I'm a professor at the UCLA School of Nursing, and initially my program of research and practice was in the field of oncology, with a special focus on people with lung cancer. As I did my research focused on quality of life and symptoms of people with lung cancer, we also uncovered that tobacco use made a difference. It made a difference in their weight loss, it made a difference in respiratory symptoms, and it made a difference in quality of life. Now we know in the 2014 Surgeon General report that in fact quitting smoking even after a diagnosis of cancer is a very, very important thing to do. I've been involved in tobacco control because of my compassion for those people affected by lung cancer, and did my actual first educational training program for nurses at a world conference in Paris. I've been involved in tobacco control for about 25 years and have worked with nurses in China and in Eastern Europe, as well as in the United States. And I just think this is a wonderful opportunity to sort of pool our experiences because we have many similarities. One of the things that I have been particularly interested in are barriers to nurses' engagement in tobacco control, and one of those is smoking among nurses. As Emma mentioned in the introduction or earlier about tobacco-free nurses, this was a funded project a number of years ago by the Robert Wood Johnson Foundation that led us to focus our efforts in the United States on smoking among nurses. And we've learned a lot, and I hope to share that with you during the discussion today about other things that may be important. One of the things I do know that is very important is that nurses, female nurses, shared their experiences through the participation in the Nurses' Health Study in the United States, one of the largest long-running studies on women's health. And in that study, we found out that nurses who smoked died earlier, had more disease, nurses who quit benefited, and nurses who never smoked, of course, had the best health outcomes. And I always like to remind my students and others that it was nurses who revealed the devastating consequences of smoking on women's health. So Emma, back to you.
Linda. Thank you, Linda. And from the less than sunny UK, I'm a little bit jealous of your weather still. Moving on. Okay, so thank you everybody for introducing yourself. I'd like to start by asking Antoinette, really around the students that you work with and your colleagues, in terms of resources and nurse-specific resources, what do you think would help? So we have a huge body of nurses. We could really make a big difference. And yet we know that not all nurses do intervene in tobacco control for all sorts of reasons that I'm sure we'll talk about in a little while. So Antoinette, in your opinion, what resources do you think would help the most for nurses to get more involved in treating tobacco dependence?
Well, we will mostly need training in how to apply tobacco dependency interventions and also funding. Currently in Jamaica, we have a high number of non-communicable diseases, and this is the leading cause of mortality and morbidity in our population. It has affected the quality of life of the persons in Jamaica as well as the productivity of our nation, as we're spending a tremendous amount of resources on healthcare. Now, we believe that nurses are critical to help to fight tobacco control issues and to implement the policies. So we would love more training opportunities. For example, our nursing curricula doesn't have enough information in neither the undergraduate or the postgraduate level to support the training and implementation of tobacco dependency treatment, and also funding opportunities so that nurses can conduct research to enhance our patient care and just to improve the knowledge of these resources that are available for our patients. Thank you.
So you were saying, Antoinette, about training at undergraduate or even postgraduate level, or pre-nursing and post-qualification. Do you have anything in the curricula which is possible? And at your school, at your university, do people get routinely trained?
No, that is not so. It is barely touched in the mental health course where they talk a little bit about addiction, but it doesn't go further to discuss the treatment modalities that can help person quit tobacco addiction. Also in the undergraduate program, it is integrated more in our pathophysiology course where we talk about the impact of smoking on the development of NCDs, but it doesn't give us a clear understanding about the nature of the tobacco industry or the evidence-based studies that can aid in persons quitting cigarette addiction or tobacco addiction.
Okay, thank you for that, Antoinette. Grace, Linda, anything? Grace, anything from you?
In New Zealand, all the schools of nursing do routinely train their student nurses to deliver brief interventions. It's part of the overall fulfilling of the targets, and so the demand for that was driven from the health sector itself back into the schools of nursing, as well as through our advocacy work. We did a couple of surveys, one before and one after the systems had been put in place, and we found that all the schools that responded were delivering, only 2 didn't respond. So yeah,
That's fabulous. So that was a real example of sort of grassroots up, this is what we want to do, and then it happened. That's miraculous.
Yes, it was a lot to do with the requirement to reach the target and by the government. So, but yes, they did put the systems in place, and then we
It's never quite as simple then, is it?
yeah, no, we ran around the schools of nursing and said, and then of course I think demand from the health sector itself back into the schools of nursing, that was a critical thing as well. Yeah.
Okay, thank you, Grace. Linda, anything to add?
Yes, first of all, I want to remind everyone that nurses aren't alone in this in terms of having limited education and skills as part of their educational training. This is changing, but it is still widespread among physicians and other healthcare providers, dentists, respiratory therapists. It's interesting in the United States when the 1996 guideline first came out, first evidence-based guideline on treating tobacco dependence, it really wasn't marketed to the staff nurse. And it was also not marketed to many of the faculty. When we did our survey of nurses in the United States, we found the same thing that we found when we did our survey of nurses, nursing schools in China, and that was nurses get a pretty good understanding of the health consequences of smoking. And as both Grace and Antoinette said, they don't get enough, or at least Antoinette said, they don't get enough about actually then going forward and providing an evidence-based intervention. Now, I am also very impressed and excited about what's happening in New Zealand, and I'm very envious about your march forward to meet your goals. One of the things that's happening in our University of California system, which is a system of 10 campuses, 5 medical campuses, is we're putting in a new initiative that every patient who enters the hospital will get identified for their tobacco use, and then if they're a tobacco user, they're going to have a referral to our telephone quit line. And what we've been trying to do in some of our educational opportunities and studies is to increase nurses' awareness and recognition of this free resource in our country, which is absolutely underutilized.
Thank you, Linda. And if I'm allowed to add to that, that we have something similar in the UK, in that we have free at the point of delivery population level stop smoking services, and the NCSCT, which my colleague Andy leads, have been doing something very similar to that, Linda, but actually building it in electronically, so that at the point of booking and checking you in, and when it's identified that you're a smoker, there's an opt-out conversation, a very brief advice intervention, an opt-out conversation, and then electronically that referral just happens at midnight that night. So it isn't everywhere yet, it's only being piloted, but in the pilot hospitals it's worked significantly and really made a big difference. So all good for getting nurses and other healthcare professionals involved.
Right. I think over the next decade, if I just might add, with the emergence of the electronic health record, I think we're going to see a renewed focus on identifying tobacco users and hopefully then also connecting them with treatment. So it's a very interesting time.
Yes, fantastic. It's really very positive. I wanted to say, I forgot to say earlier, apologies attendees, I forgot to say earlier, I'm about to launch a poll. So while the panelists are talking, if you want to add, please do send your questions or comments in, and I can flag them up. If you agree with what we're saying, if you disagree with what we're saying, please do let us know. Equally, I'm going to post this poll about your country. So if you've got an opinion, please, again, please do participate. Okay, I'd like to take us on then back to Annette, if that's okay, around if you're identifying that you think training would be good, what's your biggest wish? If you could change one thing for your country and your region around nurses getting more involved, what would you like? What's your top wish?
Well, it would definitely have to be having it integrated in the undergraduate and postgraduate curricula, as currently our Nursing Council of Jamaica mandates the curriculum. However, we have recently had curricular revision, but this topic again was not included. And also to have it being placed in the licensure exam, because if it's there, I think more nurses would pay attention to the fact that you're being taught, you're being tested, and it's something useful in also helping the country to meet its developmental task of reducing NCDs. Another thing I think too is just to have tobacco dependency services offered at all levels of the healthcare system, making it accessible to persons, affordable, and as an acceptable form of treatment in the prevention of NCDs. Another wish for me is to have opportunities where we'll have capacity building with other universities globally to strengthen our nursing cadre in tobacco dependency treatment. And as what Dr. Wong has been doing down in New Zealand, I think that's also wonderful, looking at nurses and their tobacco use, because we tend to, persons will emulate us, and if we're smokers, they will see no wrong in being a smoker themselves. So I think that's very important. And funding opportunities. I can't stress that enough, because as a third world country, we are currently implementing austerity measures that are being imposed by the International Monetary Fund. So fiscal management currently has to be very tight. So you can see where training opportunities might be very limited for tobacco dependency training currently. So I wish to have more funding in that area. Thank you.
And do you think funding is the only barrier to achieving those things, or do you think there's something else that's a barrier that we could problem solve?
Oh, most definitely not. We need to have the political will. And currently our Minister of Health, he's doing a wonderful job, but we do have to struggle with interference from the tobacco companies. So even implementation at the policy level many times is very slow, very, very slow. We had signed we're signatures to the convention, the Framework Convention of Tobacco Control from 2005, and it was only in 2013 that our ban on smoking in public places was implemented. So you can see the length of time it takes for policy implementation. Also, just sometimes the training opportunities that exist, they're often doctor-dominated. So they will train the doctors first and then consider training the nurses. But being that we are the largest healthcare workers, I think that we need to be more upfront in the training, because we are with the patients more and we can impact change. Thanks.
Thank you for that. I think that's really interesting. You made some really interesting points there. I'm sure others will agree. Linda, anything that you'd like to add to that? And if I can just ask you, Linda, as well, we have a attendee who said the free resource you mentioned. Can you just give us a repeat of that?
Okay, so the free resource in the United States is the quit line, which is 1-800-QUIT-NOW. That means that any smoker in the U.S. can call this number and get evidence-based intervention. That means a thorough assessment of their tobacco use. In some cases, they may also be able to get appropriate pharmacotherapy, and then also follow-up calls which monitor and support and are there for relapse prevention. So the quit line is also present in other countries in the world, but it's an excellent evidence-based intervention that could accompany a brief intervention of nurses in the hospital. One of the things I want to pick up on, because Antoinette mentioned a very important thing, and that is smoke-free environments. At UCLA, I was fortunate to be able to lead we have a tobacco-free campus now. The University of California, which is about 250,000 students, is now tobacco-free. the new normal for college students in California attending the University of California is going to be a tobacco-free environment. And what we do know from workplace and other studies is that when environments are smoke-free, it increases quit efforts, which is just marvelous. So I think that's it took a while in your country, but I think it's very, very exciting news.
Great. And Grace?
In New Zealand, as I said, we have these systems, but even with the systems and the training that the nurses do, systems to work, we have to get systems to work because we still have nurses who do not think of smoking cessation as part of their job. And so it's about problem solving and then presenting things in ways that maximise the chances for lasting changes in our practice. And so because we're nurses, we can work within the context of nursing culture to do that. So for example, in New Zealand, nurses are taught to use a partnership model with clients. And they're taught to listen to and respect their patients. So we're currently developing a campaign to get patients' voices, their experiences and what they want from nurses with regard to smoking cessation heard by nurses. So our initial testing of a 2-minute video where patients talk about what they want has been very interesting, and it has been challenging for nurses to hear what smokers want. But mostly the nurses have felt it was worthwhile and been eager to implement changes in their practice in response. What's really important is the support of national nursing unions and associations. So this is for all nurses. And getting this support is something that only we as nurses can do because we belong to these organisations and we're nurses. Because if these national nursing associations, unions don't buy into what we're doing, they can block our efforts to implement smoking cessation interventions by nurses. For example, in New Zealand, nurses can provide fully subsidised nicotine replacement therapy to smokers. But we had to work very hard to overcome barriers like nurses thinking they can't legally do that. They thought that they were prescribing, but in fact they were providing access to an over-the-counter medication. And then in countries where there are not the systems in place, national nursing associations, we can support them to advocate for education and training and funding for nursing smoking cessation interventions. Yeah, thank you.
No, thank you, Grace. I think that, yeah, you made some really good and interesting points there. And again, I'd ask those of you, and thank you very much, people are voting merrily in the polls. I'm very excited about that. We've just had Eurovision and it's very similar. So great, and please do keep giving us your comments and questions as things are passing by. Okay, so I'd like to move us on to asking you, actually, Grace, if we could learn from that experience then that you've had in New Zealand, where it sounds like you're, actually I don't think it's too extreme to say leaps and bounds ahead of some of the rest of us anyway. Is there one really big ticket thing, so one really big ticket item or action that we could take that would deliver a quick win, or is it all sort of slow burn, hard won?
In New Zealand, I think it was the political will. So that's what the other panelists have talked about. And so when the political will is there, then the systems can be put in place, and then the training and the funding can follow. It is hard to work from the ground up, but it has to be done. Both of the things have to be done together, I believe. So without nurses driving the training and driving the demand for funding and so on and so forth, it can't happen.
And do you have, do all of the panellists, is there a national director of nursing or a national, in the UK we have chief nursing officers, is there a national politically linked lead nurse? So Grace, do you have one?
Yes, we do have a chief nurse, and the chief nurse was, we engaged the chief nurse at the very beginning of our process, and he was very supportive. We got him to do things like write the foreword to our survey of nurses' smoking history and their delivery of interventions, and so throughout we've maintained a good relationship with the chief nurse. The problem, I think, the difficulty for chief nurses is they do work with the ministries of health, and so the ministries of health, of course, have to reflect the government perspective. So they're very helpful, but again, you have to have the political will so that they can, you know, support nurses to do what we want all nurses to do with everybody who smokes and every young person to stop them from smoking.
Yes. And Antoinette, do you have a chief nursing officer, a national nursing lead that's politically linked?
Yes, we do have a chief nurse, and currently our Nurses Association of Jamaica will be making a position statement as it regards to tobacco dependency treatment. They have been quite active in having the laws implemented and other civic society groups, because as we identified previously, the political will has to be there, and Dr. Wong too added. But is there, in New Zealand, was there room for the civic society group external of the nurses and the Nurses Association? Did they play a major role in getting you moving ahead so far?
In New Zealand, the reason we have a goal for a smoke-free New Zealand by 2025 was a result of an initiative driven by the Indigenous people of New Zealand, by Māori, who really demanded a parliamentary select committee to look into the harm to Māori by tobacco companies. And through that process, Māori were able to express their grief and hurt at the proportion of their population who have died of smoking and who continue to die of smoking because of the high smoking rates. And it was a way to get the government to listen. Now, nurses supported that process all of the way, and it was a great rallying point for nurses to come together, because nurses do want to address inequities, and nurses will listen to what patients and clients say. So we were really very fortunate in having that select committee to, you know, to lead or to affirm what we were doing.
And what about you, Linda? Do you have a supportive national lead?
Yes, I'd like to pick up first on what Grace just brought up about tobacco use really as a social justice issue that we know now, where there are tremendous health inequalities, not only in who's smoking, but also who's getting access to treatment. In 2012, my colleague, Dr. Stella Bialis, and I were able to attend the WHO Global Forum on Government Nursing and Midwifery Officers, which focused on the role of nurses and midwives in the NCDs. And we were able to publish a monograph on how we can enhance nursing and midwifery capacity to contribute to the prevention, treatment, management of NCDs. And I bring this up because it provides some language and some direction for implementation for nurse officers around the world. So yes, the nurse officer in the United States, but also we've been working with nursing organizations. I mentioned I was an oncology nurse, and one of the organizations we've been working with is the International Society of Nurses in Cancer Care. We've just updated the tobacco control policy for that organization that hopefully will go live very soon. But I think there are some very exciting policy efforts that can also be brought down and implemented in specific countries.
Thank you, Linda. And again, if I'm allowed, just to pick up on that point, we've like I say, in England and in the UK, we've got these free stop smoking services which are available at population, at individual level across the population, and some really fantastic work by Linda Bold, Janet Ferguson, Ken Judge, etc., to evaluate those and the long-term effects of them showed that they actually do reduce inequalities. So it's one service which we know the inverse care law doesn't apply to, because in the UK anyway, they are accessed by everybody and the same outcomes. Everybody gets the same outcomes. So no matter what your level of deprivation, you're as likely to quit as somebody who's much more affluent. And so actually we see a reduction in inequalities through these services. So that's a fantastic, phenomenal outcome that really is very rewarding, especially from a nursing perspective, I think. Okay, so if I can move on and move us back to training, actually, if that's all right, training and curricula. I know we've touched on this already, and it does seem to come up again and again and again that systematic change might be a way forward. So, Linda, if I can ask you to give us your position really on the level of impact that we think that tobacco dependence identification and treatment programs could have on delivery of nursing care and nurse education itself.
Thank you, Emma. You know, my thinking about this has evolved over time. Initially, I thought that the way to get these curricular changes was to change certification exams or Board of Registered Nursing exams, so that if the nurses took the examination, in order to pass, they must have some knowledge about tobacco dependence. But then there were some problems, because we knew that some of the faculty weren't prepared. We knew that some of the textbooks didn't have adequate content. So now my thinking is that the driver should be on accreditation of schools of nursing, and not just schools of nursing, but other health professional schools. That usually in every country there's certifying bodies, and I think we should work with the leadership to make certain that if this is going to be a school of a quality school of nursing, then it must include tobacco dependence in the School of Nursing content. For example, it would be unimaginable if students attended a school of nursing and they weren't taught how to manage an IV or give an injection. And I want to put tobacco dependence treatment on one of those unimaginables, the leading cause of preventable death in the world. And what we know now is, especially because of the World Wide Web, there are more resources than ever before. There are lots of resources out there, as long as, again, we have the political will to implement them. Thank you.
And Grace, do you have anything to add to that from your perspective?
I completely support what Linda says in terms of the accreditation of educational schools for health professionals. If there was a requirement that smoking cessation and tobacco dependence and tobacco control were part of the curriculum across the board, and schools were audited against this, that would bring about change right through the schools of nursing. There are issues with academics who are not, who are, well, in universities and technical institutes and schools of nursing, who maintain their currency in their field, of their specialty field, but are not so current across the board. Mm. It's a hard thing to do, though. It's a hard thing to do. We've been trying for a long time.
Well, yes, but I happen to be talking today to a student health visitor, which is a public health nurse here in the UK. So she's a student public health nurse, and as a student postgraduate public health nurse, she isn't getting any training on tobacco dependence. That seems insane to me. It seems really very bizarre. I can't quite get my head around it, but anyway, we're going to do something about it, which is a good thing. What about you, Antoinette?
Well, I do agree in having it integrated in the nursing programs and also in the licensing program, and having it as a core competency for any nursing program and linking it to accreditation. I definitely agree with that. But another barrier I perceive too is also nurses' utilization of evidence-based information, because as Dr. Sarna pointed out, there's a lot of information there globally, but are nurses really accessing this information? So we ourselves sometimes can be a barrier to implementing tobacco dependency training. And I think it's just because of our lack of awareness of the impact of tobacco and the tobacco industry on driving the epidemic of NCDs. Until nurses are fully aware and can appreciate our role in the fight against tobacco addiction, I think all of what we say may just be going around between the converted. We all agree, but there's a huge number of nurses who are still not tapping in on these resources.
Mm. And do you think that that's because they don't know the resources are there?
Yes, I think that is partly it. Partly it. They don't know where they are, and they are really not aware of the framework convention of tobacco control. If they are looking in on the policy level, it would inspire them to read further and recognize the impact of tobacco on global health. And I think it will motivate them also to go out and seek additional information.
That's, again, really interesting point, Antoinette. Was one of the things which is which is very rewarding, isn't it, about tobacco dependence treatment, is the swift nature of seeing an improvement. So often in nursing or in caregiving or in any of the healthcare professions, we intervene and you might not see such a positive impact so quickly. Do you think that that's something that might be used to motivate people?
Yes, I most definitely believe so. In fact, I will be currently running an intervention study for persons with sickle cell disease, because since I've been doing respiratory research, I've identified that smoking increases their risk of death with sickle cell disease. So it shows that in select population, there is a great deficit of knowledge, and also we can implement change in small groups, especially the at-risk groups. So I think if nurses are seeing that, it will motivate them definitely.
We all respond to positive feedback, don't we? So, Linda, if I can ask you another question really about, to take that on to the next level. We've got a generalised shortage of adequately trained, registered, qualified nursing workforce, particularly in certain countries. Do you think that if we did, suddenly we waved a magic wand and we were able to get what we just asked for, and our accreditors and our registrars supporting us, do you think, how successful can we be within the context of prioritisation and reducing workforces? Because that's often something that we get given back to us, isn't it, when we raise these issues?
Yes, let me answer in a couple of ways. One of the things that I think that it's very important is to approach, which Grace had suggested, the notion of the brief intervention as opposed to the singular nurse providing everything for tobacco dependence treatment. I think, as Antoinette brought up earlier, clearly there are people with substance abuse, mental illness problems who need much more intensive care, and that brief intervention from the nurse that might not be adequate. However, if we can twin the brief intervention of the nurse with something like the telephone quit line, I think that's a very exciting strategy to go, so that we are working together. Now, another way, of course, that we can help propel things forward, I think, is to address smoking among nurses. And the reason I think that this is so important is because nurses themselves have many myths and misperceptions about tobacco dependence treatment. And in some countries, it is a barrier, it's a risk not only for their own health, but of course a risk for their patient, because they may be less involved in intervening with patients. So I think that as a profession, we need to vigorously approach this, both in terms of smoke-free environments, but also in terms of providing resources for nurses in practice to quit smoking. Emma?
I had not realised I'd muted myself. I
Okay.
wondered why I wasn't getting a response. Grace, do you have anything to add to that?
Smoking rates among New Zealand nurses vary by population group. And so Māori nurses, Indigenous people who have high smoking rates among their own populations, also have high smoking rates, but not as high as their people. And for them, they identify exactly the same issues that Linda's talking about. And nurses are people too, and they're just as addicted as any smoker is. And it does make a difference to whether or not they intervene. And so it's critical that we support our colleagues to get to quit and to get the resources that they need to do so. We can't move forward until we're all moving forward together.
Antoinette, what's the rates of smoking like? I know you mentioned it earlier, so what are the rates of smoking like for you amongst your nursing population?
In New Zealand?
Well, we currently have no data. We currently have no data that speaks to our nursing population. There is a little information that speaks to young persons in high school, those in grades 7 to 10, which looks at where we found 1/3 of the students in grades 7 to 10, that would be ages 12 to 16, are currently using tobacco products. And of those, 20% were currently smoking cigarettes, while 19% were using other tobacco products. So I haven't seen any literature particular to nurses. There are some on the medical students, well, that was low, and also in the nursing students, which were third-year nursing students, and that was also low, like less than 10%. So I think we're making some impact with those who are training to be in the medical field. The group at risk now, however, are the high school students and also the older persons who are reporting that they were not knowledgeable of the knowledge of tobacco on their health, and that was in a 2012 study where, regardless of the level of education, they were not aware of the effects of smoking on themselves, which I think is quite alarming.
Adding to this, we've just had a question in from, apologies if I say this wrong, Janina, who said, Linda, you address smoking amongst nurses, and they agree that that's an important point, but asks about smoking amongst teachers, and added to that, and to pull it back into nursing, what about school nurses? Do you think that there's a big role for them?
For nurses, of course. I mean, first of all, if nurses are in schools, this would be an excellent opportunity for education and for treatment. Unfortunately, because of economies in certain countries, including our own, we don't always have nurses in the schools. But I agree that it's very, very important to address the issues of prevention as well as treatment in the young. Very important.
Okay, so anything to add, Grace? Anything to add, Antoinette?
I would
Okay,
love
so
to hear from Dr. Wong, because he did some studies in healthcare workers. I'd love to hear, but nothing to add.
Grace, are you there?
Oh, in New Zealand, the census measures. Yeah, can you hear me?
Yes.
In New Zealand, the census has this question about smoking, and so every 5 years we have a measure of who smokes and who doesn't by occupational group. And so among nurses, the smoking rate in 2006 was was low, it was about 14%, but among Māori nurses it was 30%, 31. But we've had a new census now in 2013, but that data hasn't been released yet. So of course we're all eagerly looking forward to seeing if the rates have tracked.
Fingers crossed.
Yes, in the United States also, we've been monitoring smoking among healthcare professionals, and we were very excited to see the downward trend in registered nurses from almost 12% in 2003 to 7% in 2009-10 when the latest data were released. However, we also saw the continued high smoking prevalence among licensed practical nursing, seeing what we know in terms of the differential of smoking by socioeconomic status.
Okay, so still work to do then by the sounds of it. Yeah. So what we've done so far though is we've looked at quite a lot of barriers, and what I'd like to do now is really focus us back on some really big exciting things. I think we heard some really exciting things from Grace. So what are you most excited about, Antoinette, if I can lead with you, if that's all right. What are you most excited about when it comes to the future of tobacco dependence treatment, nurses' involvement, and perhaps reflecting on some of the conversations that we've had today?
Well, I'm most excited about the new acquisition of skills that will impact on the health of our nation, because currently, as I say, we have a high expenditure on health due to NCDs. I'm really excited about the role that nurses will play in not only stemming NCDs, but also to make nursing more visible, where a person sees us more as playing an active role in national development and patient care. That's basically it.
And just added on to that, Christina Martinez, who's with us tonight, has just sent a question through, which is, do nurses have tobacco cessation performance indicators? And I'm guessing that I know the answer for you, Antoinette, but do you think that that's something that might come?
Can you repeat the question, please?
Yeah, would you welcome, or do you currently have cessation performance indicators for nurses?
Oh yes, that would definitely be helpful. Definitely.
And Grace, I think because you've talked about the big targets that you've got to hit, do you have specific nursing tobacco cessation performance indicators?
No, you're not, but they would be great.
Okay, perhaps we should lobby for that.
Yes.
We've also, oh sorry, apologies. Okay, so we've just had another question come in from Audrey, who said, do any of the programs, any of the countries involved use a clinical train-the-trainer approach or nurse champion models? Is that something that you've got any experience of, Linda?
Yes, on a number of levels. First, I'd like to just go back to the last question, because in the United States with the Joint Commission, there are quality indicators for the delivery of tobacco dependence treatment. Of course, these are optional. We hope they're going to become mandatory. And in our new system in the University of California, we are going to be able to look at unit by unit how well people do in terms of tobacco dependence treatment. So I think these are other models of things that are going forward. In the Train the Trainer program, we did this in the Czech Republic. We found that it was very important and effective in increasing knowledge. However, we also found here that the nurses' tobacco status, there were about 30% of the nurses who smoked in our study, they did not benefit as much as the other nurses in terms of increase in knowledge. We've also used web-based educational forums, both in China and the United States, and they've been also very helpful. Again, another way of delivering education as broadly as possible to as many people as possible. And then finally, in terms of the champion model, we found that both in the United States and in the Czech Republic in particular, when there are nurse champions involved, it makes a tremendous difference. And that means that there's someone on the ground where this really matters. They facilitate communication, they facilitate access to resources, and yes, I think it's very, very important.
Grace, have you any experience of those sorts of models?
In New Zealand, a lot of the time there are nurses, particularly in general practice settings, who are like the resource person or champion, if you will. What would be absolutely fantastic would be if all nurses were champions for all the other health professionals and for each other, because nurses learn very well by watching other people or participating with other people in any kind of change of practice. So it'll be really great if all nurses can be champions and they can lead really. So in lots of instances, nurses manage the immunisation programs in general practice settings. They do the callbacks and so on and so forth. And it may be that, this model could be used for nurses throughout primary care, whether they take the lead role in delivering smoking cessation interventions and really embrace it. I'd really love to.
I can feel some international collaboration coming on. What about you, Antoinette? Any experience for you of using the train-the-trainer approach on nurse champions?
No, we haven't had that opportunity currently, but the Ministry of Health, they have started a training program in which they say that's the model they will be using. So at the university, we've been trying to liaise with them to see if we could collaborate in training nurses for the Caribbean and nationally as well. So that sounds like a very good model, because nurses do learn well from other nurses. We don't want to be taught by other professional groups. We have a better understanding since we're with the patients more, and I think we would work better.
Fantastic. I think we can definitely look forward to watching the results of that. Okay, so you've all done an amazing job of staying with us. As I say, this is the first time we've done it like that, and I apologise that it's me that messed up earlier. I'd like to leave us with a final question, starting with you, Grace, if that's okay. So World Conference is coming. What would you like to see happen at World Conference?
I'd love to see nurses up front and sharing and inspiring and leading at the World Conference.
That's not a bad aspiration, is it, Lynn?
Hello?
Linda, do you have anything to add?
Absolutely. I would like to see nurses in plenary sessions at the World Conference, not in a pre-conference workshop, marginalized, not just in the small abstract sessions, but in the plenary sessions of the World Conference. The largest group of healthcare professionals deserve their place there.
Hear, hear. And Antoinette?
Well, I think they could not have said it any better. That is remarkable. Yes, I agree.
Okay, well, I'd like to take this opportunity to thank all of our panelists. Thank you all for asking. I'm going to try and share the poll results, which are interesting, pretty split. And thank everybody for participating, everybody for their time, and hand over to Jess to finish up. Thank you all very much.
Well, I don't have too much to add, but
Thank you,
I
Emma.
want to reiterate our thanks for all of the panelists and for everyone who joined us today. I know, like I said, timing was a little awkward for some people. We'd love it if you would take our survey. It should pop up once the webinar is over. And like I said before, if you do need a certificate of participation, you'll need to take the survey. And lastly, happy International Nurses Day, and thank you all for the hard work that you do in tobacco dependence treatment and healthcare in general. That's all we've got, so thank you all for staying on.
Thank you. Bye-bye.
Thank you. Thank you. Bye, everyone.
Thank you.
Goodbye.
Bye-bye.
Thanks again. Bye.